Hi everybody, I'm Matt Salo, and I'm the Executive Director of the National Association of Medicaid Directors. We represent all 56 of the nation's state and territorial Medicaid agency leaders. The past year has been an extraordinarily difficult and challenging time for all of us. But it is through this past year that we have learned a lot about who we are, about what we do, and about why we do it. So I'm thrilled to have some key members of our executive leadership team here with me to say thanks and to share our appreciation for all of our partners without whom the continued success of the Medicaid program wouldn't be possible. I'd like to first acknowledge Kate McAvoy, the Medicaid Director in Connecticut, and who has been a key member of the NAMD Executive Board and leadership team for most of her 7-year career as the Connecticut Medicaid Director. Kate.
Hi, I'm Kate McAvoy. I'm the Medicaid Director in Connecticut, and as Matt shared, I've had the privilege of serving on the NAMD Board of Directors. As we take this moment to thank you, our colleagues, as well as our many partners, we'd first like to recognize our collective reason for being in Medicaid and CHIP, and that is the over 77 million people whom we serve. Parents, children, older adults, and people with disabilities. Folks to whom our programs provide comprehensive health care that enables children to meet developmental milestones and engage at school, supports adults in remaining employed, and promotes choice and self-direction for folks who receive long-term services and supports. I know as we recognize all of you and all those who make our programs possible, these are the folks for whom we focus on a day-to-day basis.
Hi, I'm Beth Kidder, the immediate past president of the NAMD Board and the Medicaid Director in Florida. I want to thank the Centers for Medicare and Medicaid Services and our partners there. They provided almost around-the-clock support to the 56 states and territories as we navigated a new universe of waiver flexibilities and pandemic support. And they did so at an unprecedented scale and speed. I want to extend a special thanks to Calder Lynch, Anne Marie Costello, and Karen Shields. They were outstanding leaders in this crisis. I also want to thank the Biden administration for their partnership during the transition, including quickly signaling the likely extension of the public health emergency through the end of the year. We appreciate you.
Grateful thanks also to the many organizations that have provided generous financial and other support for NAMD's multidimensional leadership agenda. Among them, State Health and Value Strategies, the Commonwealth Fund, the Annie E. Casey Foundation, the Center for Healthcare Strategies, and the Wellbeing Trust. These targeted investments have recognized and honored the unique role of Medicaid directors and enabled specific and actionable supports over the course of an enormously challenging last year. We're really indebted to all of you.
Hello, my name is Jamie Snyder. I serve as the Director of the Arizona Medicaid Program and the President of the NAMD Board. I want to express my appreciation for the contributions of our industry partners. Your continued support of NAMD's Fall Conference is critically important, particularly this year, as we were forced to dive into our new reality, hosting a virtual conference for the first time in the association's history. We missed seeing you in person, but appreciated your willingness to meet with Medicaid directors and their leadership teams remotely, both during and following the conference. Your sponsorship was essential to making our virtual event a success. A special thank you also goes out to Medicaid health plans and the health plan member associations, ACAP, AHIP, and MHPA. Simply put, we couldn't do it without you. Thank you for your leadership and commitment to serving more than 1 in 5 Americans and advancing the importance of the National Association of Medicaid Directors and Medicaid programs across the country.
Hi, I am Allison Taylor, President-elect of NAMD and Medicaid Director of Indiana. I have the honor of thanking our incredible Medicaid providers. You stepped up in times of crisis. From the emergency room to the community to the home, you completely transformed your practices and methods of delivery. You were gracious, you were flexible, and you were innovative. I want to recognize our behavioral health providers for maintaining critical lifelines for our members. I want to thank our long-term services and supports providers for their diverse ways of providing support to the most vulnerable. I want to thank our federally qualified health centers for bridging into our communities, and I want to thank our first responders and EMS personnel for not skipping a beat. The list could go on and on. As we look towards recovery with our provider partners, I want to highlight an important new series of papers that NAMD will be issuing on the critical role Medicaid will play in our nation's recovery. These papers will feature evidence-based, sustainable policy and program solutions on three very important areas: behavioral health, long-term services and supports, and children's coverage. We look forward to working together to solve the complex health and social issues that the pandemic is unearthing. Together, we can emerge as a stronger program.
I'd also like to thank another key group of folks: former Medicaid directors, or as we like to call them, the alumni. I've had the pleasure of working with Medicaid directors for more than 25 years. And the Medicaid directors who have been in this role and have moved on have been some of our strongest advocates and some of our greatest partners. They've been in the shoes of the Medicaid director, and they desperately want them to succeed. And we want to thank you for your ongoing partnership and support. We've also talked a lot about the public-private partnerships and the state-federal partnerships. But I think it's also important to acknowledge the state-state partnerships. The work that we do with our state partners, governors, public health officials, individuals who run agencies across the spectrum of the state bureaucracy: aging, disability, ID and DD, mental health and behavioral health, and the budget agencies, NASBO and FFIS, and last but certainly not least, our good friends in the legislative branch at NCSL. Thank you for all of your support over the past year as we've worked to make this the best out of what has been a very, very difficult situation for us all.